Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it.
Hey everybody, Crystal Stokes here, and joining me today is Dr. Sonja Olson and Susan Swendsen Harris, who are both members of the Full Circle Lab team as veterinary wellness and leadership coaches. And we are here today to discuss the very fascinating topic, in my opinion, of mental health first aid in veterinary medicine. Before we dive into the topic today, I just want to take a moment to let each of these wonderful young ladies introduce themselves. Sonja, would you mind going first?
Sure. Oh, I'm delighted to be with you guys and to talk about this with our community. So I'm Dr. Sonja Olson, DVM, located out in Vancouver, Washington. My pronouns are she, her, hers. And this is really the space I'm swimming in these days. So as a long-term emergency clinician, times a couple of decades, experienced and witnessed plenty of suffering and people wishing they had more tools and knowledge. And over the course of time, I've recognized that there's a real need for peer support. That's what I'm doing. I'm writing, I'm speaking, I'm coaching and mentoring around peer support of amazing veterinary professionals, like being part of Full Circle Lab. Ready? Susan.
And thank you so much. And I met Sonja a few years ago after I graduated University of Tennessee in the veterinary social work program. My goal in joining a vet social work program was the beautiful souls and the beautiful people that we see in vet med, and really understanding the human needs of caregiving for animals and what that is. And so part of this conversation is just simply that, is looking at how do we meet those human needs and how do all of us as human meet those human needs, which is why I'm part of this team and why I'm just so excited for this topic.
Well, Sonja, actually, is it okay to have you plug your book? Because I think that's going to be a tremendous resource. I know it's in the pipeline, but I think it's worth noting for people listening.
Why, thank you. That wasn't something I intended or thought that we would do, but yay. No, I'm super excited that the workbook that has been living inside me for a couple of years, it's the next bit. If the 2022 publication was the what, like what are we experiencing, what's the language and the beginnings of a toolbox, this is the how. So it's creating a space of me, we, us, structure so that we can have a thriving veterinary journey, realistically so. So that'll be out in spring 2026 through CRC. Thank you, Crystal.
Congratulations. Yeah, congratulations. So cool.
Yeah.
Right. So for those listening today who have never heard of mental health first aid, I would like to take a stab at just roughly defining it. What is mental health first aid?
So mental health first aid was actually founded in Australia in 2000, and it was a mental health public education program. And so it was mental health publicators. It was a woman named Betty Kirchner and Anthony Jorm that got together to look at the basic premise that is that people who are experiencing mental health challenges are more likely to seek help if someone close to them suggests it or holds that space. So since 2000, so that started in Australia. In 2008, it was brought to the United States through the National Council for Behavioral Health and the states of Missouri and Maryland. And what they were doing is they were looking at that public education and, again, trying to figure out what are the spaces that people with mental health challenges are experiencing, but being misunderstood, not being seen for they were being seen for what's wrong with them, but not really what is happening. So how do you, through a public education platform, expand that lens and then and then go ahead and be able to address the needs that people have. So in 2012, there was actually a youth version that was brought, and then a teen version. And so right now, currently, 29 countries have adopted mental health first aid as a public education platform. And the goal, and right now, I believe it's 4.5 million people have been educated in mental health first aid. The goal is to have in each country 1 in 15 people trained in mental health first aid, knowing that you're side by side with certain people, or you're in a classroom with 30 people, statistically, 2 people in there understanding mental health first aid. So you can see it's understanding what that looks like and having that lens of what is happening in these moments when someone is experiencing a mental health challenge.
Oh, good. What's the difference between mental health first aid and therapy? Like, let's say I have a clinic. I can clearly see that one of my teammates is really struggling. Maybe they're showing signs of panic and breathing heavy. They run to the bathroom. They're crying. They come back on the floor. They try to pull it together. It's happening repeatedly day in and day out. We're really worried about them. Why not just give her a little nudge and say, hey, maybe you should go to therapy. Like, what's the difference? How do we know when to use what? When is it appropriate to use mental health first aid?
And I'd love to answer it as a peer supporter, right? Somebody who does not have the credentials that Susan has or that you have, Crystal. I'm not a licensed mental health professional. I am a human being who has awareness and skills and compassion. So how do I have the courage and the wherewithal and skill to approach that person in a way that is meeting them where they are? So for me, as a human without that sort of training, I found the mental health first aid program to be incredibly resourceful in terms of providing me with the language, the mindset, and the practice, with some real contextual opportunities to look at, oh, it's like this, as well as then having an awareness for vet med that we know that help seeking in veterinary medicine is terrible. It's not just vet med. Medical care professionals tend to be very resistant, reluctant to seek care for themselves. So peer professionals being prepared to meet their colleagues when they are in a state of crisis or distress is incredibly important, and that we feel prepared to hold them and pass them along. So I think that's it. We know our guardrails. We say, it's not for me to fix. It's not for me to take on. It's for me to walk alongside you and get you to the people that are prepared to support you. And then I'll pass it to exactly that time to Susan. So Susan, what would you say?
And exactly everything you said. And it's noticing what's happening in the moment and bridging. And I go back to an article that I read in the early 2000s about veterinary professionals and how 70 to upwards of 82% have said that they are experiencing some type of mental health challenge or have at some point in their profession. Yet only anywhere from 5 to 12% actually get that help. And so mental health first aid is that gap, is that noticing that experience and noticing what's happening and then being able to walk into it. And I often say in vet hospitals, it's when you see somebody sitting in the hallway crying and obviously having strong emotions, and instead of going, oh God, do I have to walk by them? Can I maybe take another door? And being able to walk up next to them and sit down next to them and say, hey, I'm here. That to me is the difference. And that's what mental health first aid really is. And therapy, of course, is the bridge. That's where you're hoping to get them to. But mental health first aid has lots of other options besides just therapy. Mm-hmm. And they emphasize that.
We're going to dig into those. So to kind of restate what I'm hearing you say is that mental health first aid is really the front line, right? It's that triage. It's what happens in the immediate moments where you're there in the hospital and you see something is happening and you just want to be there peer to peer to be able to meet them where they are and help create that movement in whatever direction they may need to go. But you're like a little bit of a catalyst in a way, like creating some safety and some comfort. And I see you and I'm here for you. And there's something we can do about that. So it sounds like mental health first aid is also there to help increase utilization of getting supports. And so many of us in these healthcare professions are just like, bare our teeth and get through it the old-fashioned way. And we know that's not working so well. So mental health first aid is coming in to sort of help motivate us to maybe try a different way in a very supportive peer-to-peer fashion. I think a lot of the research, too, has shown that we're much more interested in taking support from peers, from people that get it. They've been there with us. They were there the whole time, right? So we're not having to explain it to somebody who's never been in vet med, who just doesn't know what it's like to face these challenges day in and day out. Like a peer has the door is open to a peer.
Mm-hmm. Yep, exactly.
Would you like to say more about what you're just kind of like leading into with, this next stage of where mental health first aid fits in to the veterinary model?
Well, I'll start it and then I'll pass it to Susan. How about that? I take it. We'll do halvesies. So it starts with peer support. So that's one of the things that you have resources, informed peer supporters. So I think that's an opportunity for veterinary medicine that is rising and blooming, is that there are more folks that are aware of how valuable having somebody who's a wellness champion, a wellness ambassador in their midst, people who are prepared and skilled and supported themselves, and that they are very, very clear ethically on the guardrails. So peer supporters are huge. But it also includes, though, other support spaces that are not specifically therapy, they're community space. And that might include people who have a lived experience. That might include small group discussions. That might include hotlines and other crisis texting spaces. People, again, who have experience and capacity to hold with, and this is really good, important actually for vet med, particularly a compassionate empathy, that we are being very prepared to not take on the emotions of other, that we also are getting prepared, I hope, to be in a space of compassion rather than just wide open empathy. So inadvertently causing secondary traumatic stress to ourselves as well as empathic strain. So with that, Susan, I'll let you take it from there.
Thank you. And so it's very specific to a framework, and the framework has in the middle of it assessing. So assessing the need, really looking at what those needs are, and then following it. It's called an ALGEE action step. And so having peer supporters that know these ALGEE steps, and the A is to approach someone and actually approach and say, are you okay? Or what does that approach look like? And then to listen non-judgmentally, to give reassurance and really understand what reassurance is. Not advice, not directive, but really giving reassurance. And then the E is encouraging self-help. Because sometimes it's hey, I've tried this or I've tried that, or do you want to come to my yoga class, or things such as that. And then the other E is encouraging professional help and knowing what professional help is. So really educating people on what it is, because sometimes people don't understand what professional help is, and it's hard to understand the alphabet soup that I know Crystal, but others, veterinary professionals may not know. So being able to properly educate in that and allowing people their choices, and knowing too, because mental health first aid talks about when it's a non-crisis, and then it's leading up to a crisis, and then when you get into the severe crises, what each of those steps looks like in each of those situations.
I'll just build on that just really quickly, because as veterinary professionals, particularly the nursing staff and the doctors, we like algorithms. We like scaffolding. We like if this, then do that. I really do feel like they've structured this in such a way that somebody who thinks like that, whose brain is conditioned to think like this, can grab hold of it and adapt it, and it makes sense. So when you were speaking that out about the ALGEE plan, it is like, right, it helps people who are unfamiliar with this application of their strengths and the way that they think. They're applying it now to the humans around them.
I love that. Okay. I like the ALGEE framework. Really appreciate too what you're describing is that if you get trained in mental health first aid, you learn how to assess what category individuals fit into in terms of severity. And based on the severity, you have different paths you might take. So I think that's very comforting, because many of us get overwhelmed when we see someone struggling. And, very triggering statement is when somebody says they might feel suicidal. We get calls about that all the time. What do I do with this person? This is like in the red zone, right? This is very, very scary. So mental health first aid covering this spectrum of issues that can come up, and how do you then support that person? Yeah.
I mean, and for someone, again, myself, who didn't train in this and didn't choose, to necessarily be in a profession where, well, mental crises happen. They do. We're in a highly emotional and traumatizing, profession worldwide. And what we found is that folks are show up the way they do with whatever they've had before becoming a professional and whatever is going on outside their lives. That comes with them, of course. And we go into these environments, and sometimes it is a crisis before you know it. Having the opportunity to, again, have some practice with the language, they actually have you practice saying, are you thinking about suicide? And I can recall very, very clearly, and I still feel it. Okay, it's still here. It's like, it's scary to ask that question, and it's essential. It's essential. You save lives asking that question. That's another really, really beautiful place of exploration, is that being in a place of courage, even in the face of feeling really scared alongside this individual, you may save lives. So it's an important place of practice and being with the emotions, so that if you should be in that place, you're a little bit better prepared.
And in each of those things, like Sonja was talking about, each of those things with like suicidality, like anxiety, they talk about the early signs and symptoms, and then as it progresses and what you see, and it breaks it down to what is the behavior, what's the appearance, what are the feelings, and what are the thoughts. And so one that always sticks out to me is late for work. Sometimes people, and we understand that late for work, we need to take a punitive action, or we need to go that line. What is wrong with you? And work certain interventions. But then when you couple it with what might be happening, or what might be the early signs and symptoms of a mental health challenge, then your response can be tailored to really meet that person's need, get them where they need to be, and then be able to make the adjustments to that behavior. Mental health first aid says, and we know this, the earlier you intervene in a mental health challenge, you can maybe thwart the trajectory of it becoming that major crisis.
Yes. It's just like in veterinary medicine, right? If you get intervene early in a disease process, you have better outcomes. It's the same thing. That's beautifully said. Could we dive into a few examples to make this really real for those listening and are trying to imagine, like, how would this look in my clinic? Like, how does this happen, boots on the ground? Could you share a couple of examples? While we'll screen out names and locations for confidentiality's sake and falsify all that, but otherwise details remain accurate.
I mean, there was an unexpected example of panic attack. Now, I think I'm now much more informed. Mental health first aid has really did that, because exactly as Susan said, signs, symptoms, you might witness this. And being a doctor, I also am like, is that what I'm seeing? Is there anything else here? What are the circumstances, right? But this individual went from 0 to 60 so fast. And in that moment, being present with her and just saying, I'm here, breathe. What do you need? What do you know to do? This is not her first rodeo with this. And so bringing her to a place of knowing, and that she's not alone, she's in a safe space, and to get her to just be where she was. I knew some techniques. What was very cool is that another person who had skills came right up alongside me and started doing tapping with her, which is another technique to come back into your body and calm your nervous system. Witnessing the power of us being present for her and how it expedited her coming home to a safe space was so powerful. It was scary. It was, oh goodness, is she going to drop and go unconscious because she's breathing so hard? And I could feel her heart was racing. Still, that was a great example of, and I was thinking, oh, thank goodness I've had some training. And also knowing it's not mine to fix, it's mine to bridge.
Mm-hmm. Great example.
Yep. I remember a certain one veterinarian that had shared that she was taking the course because she had a situation with her tech where she saw the technician several times in her car crying. So when she was leaving work, she saw that the technician hadn't pulled out and was sitting there crying, and she didn't know what to say. She didn't know how to approach it, so she didn't. And then it was a time after that, it was over a year later, that technician did end her life by suicide. And she said it always bugged her because she just never knew how to approach it. So she took the class and all that. And I remember her calling and saying, "You'll believe it." She said, "I saw a similar situation. I was able to walk up and just say, 'Hey, me too. I know what you've been.'" And she said, I was able to actually talk to her. And mental health first aid talks so much. And in each example is that you're not always going to get it right the first time. You may not know. And that's what, and we say, even in cases of suicide, you can't shit on yourself. People die by suicide. And not that she had anything to do with it, but she wanted to do better and wanted to know how to approach that situation. And so when she called, she said, "I gave her the resources that you mentioned. I gave her, I connected her. I knew exactly what to do." She said, "I didn't shy away. I actually walked up and said, 'Hey,' and she said it meant the world." And so she said, "Do I know that I was able to change the trajectory? I'll never know. I'm sure I won't. But it felt so good because I finally did something. I did something that may have impacted somebody's life in a positive manner. And that made me feel good to know what to do in that moment."
So good. What I really like about this model is that, one, it's for non-clinicians. Like, anybody in the field can learn this. And I think that takes away some of the fear, because we're going to have this happen. We are all humans. Humans have physical and mental health challenges. It's just part of the nature of life. So now we can have more people empowered and feeling comfortable, or at least more confident in navigating this. And I think it's good to reduce the stigma of what we're experiencing, right? Can you all speak to that at all? Like, what you're seeing around stigma and mental health?
That came up in my mind a moment ago. And that was one of the big things that when Susan and I first got the opportunity to practice this and become instructors together years ago for the mental health first aid, the one thing that I remember us saying again and again as a team was, let's decrease stigma. Let's decrease shame, that this is a human phenomenon. And I know you guys now understand, but I certainly have had a lived experience of it and witnessed the whole, we're human kind of thing. Sometimes the veterinary professionals forget. But we think we have these superpowers, keep pushing through, and that's just not realistic at all. And so bringing the human lens towards this, and I think the stigma in vet med from the Merck there's been 4 now well-being studies, and one of the things they've seen year after year from 2017 to 2023, stigma is going down, down, down. Mental health awareness and resources up, up, up. However, even though that's so, only in this last one, in the Merck 4, they were saying the market increase in the amount of resources available from just in general and organizations investing, but only 38% of people generally even knew about the resources. So we have continued need to not only decrease stigma, but increase visibility and conversations around it. So inviting these things on the regular in a myriad of ways, written, spoken, in staff meetings, etc., leadership talking about it, celebrating during National Suicide Prevention Month, in the fall, saying, did you know this is what we're doing? So the more we talk, the more we advertise, the more we call in, good. We're on our way, but keep going.
Can we describe a little bit of how, let's say I'm a clinic owner and I'm listening to this, I'm thinking, full circle, I'd love for you to help me. What can we do at our clinic? What would that even look like to bring mental health first aid in?
What it is it's not a cumbersome process. Like I said, mental health first aid is meant to be available to many people. Many people have it for their church groups or soccer coaches or things such as that. And so what it starts with is, if you want to bring it to your clinic, it starts with having mental health. Both Sonja and I are mental health first aid instructors. And so you contact instructors. Those instructors set you up through the National Council for Behavioral Health. And you have certain class sizes. They don't like larger classes. We don't typically do that, because the process in training mental health first aid is to keep it very safe. Always have someone there to do what we call a virtual hallway, which is if some of the information might be triggering or might bring up certain feelings, that the other person can go and support that person. And then what you do is you have homework that is what we call pre-work. So it's looking at what this looks like and how it is applied ahead of time so that you come to the actual training with that knowledge ahead of time. And so then when you come to that training, it's about a half-day training, and it would be with 2 instructors, such as Sonja and I. And then we walk through each thing individually. So what is a beginning sign of a mental health challenge? How is it worsen? What is a crisis? We walk through, like Sonja said, the wording of how to handle if that crisis were a suicide. What if that crisis were anxiety, substance use, psychosis? So we walk through each one with that specific lens. We look at the wording of what that is, and then we look at the very end part is then we look at you. In any of these relationships, there's 2 people. So how do you support yourself as you are using mental health first aid tools so that you make sure that you're applying good self-care techniques? And that's how. And then after that, the person has to go back to the National Council for Behavioral Health because that's who holds the certificate, answer a few just basic questions, but then they have their certificate. Their certificate's good for 3 years. So they can use it again in their clinical practice, which is what we hope, that you use it in your clinical practice. But that certificate belongs to you through the National Council. And so if you need it, as a volunteer at school or as a soccer coach, the goal is for mental health first aid to understand that we all need mental health support and mental health supporters along our path.
I so appreciate that it has the element of how you also care for yourself in these situations, because we forget how taxing it can be, being very empathic humans as we are in vet med, to sit with somebody that's going through a mental health challenge. It is heavy. It lands in our heart. And so to have a process that you actually work with yourself on to make sure you stay healthy and whole, and that this is a skill set that can be used within the clinic and outside of the clinic. It's like a global tool for all humans, which is wonderful. Is there anything else you want to inform them about the program that you didn't yet touch on that I may have forgotten?
I would just love to highlight exactly as Susan said about the self-care aspect and the self-resourcing. And what is really beautiful that happens in that space is that the veterinary professionals who may not be giving themselves that time, that energy, have the opportunity to swim in that and reflect and have a discussion and crowdsource. So it's a way of celebrating what we're learning, how we're going to help contribute in a meaningful way, we hope, to the culture of caring about the professionals and for ourselves. And so I think that it's just as important that there's that aspect of it, that it's because bioethics is young for veterinary medicine. And part of that means in lots of other spaces, whether it's with natural disasters or military or law enforcement or education, it is ethically essential to take care of yourself. And this is the opportunity for us as vet med to try it on. So it's just one more way of reinforcing it.
So well said. I appreciate that so much. Both of you, thank you for being on today and just sharing some of your wisdom about mental health first aid. I'm excited for our audience to get a taste of what it is. And for those who are interested in learning more about it, is it okay if I put your email in the show notes so they can reach out directly if they are like, hey, is this right for me? And we can always have the opportunity, consultation, just ping us. We're happy to chat if it's fit for you. And also, is there anywhere you'd recommend they go if they just want to do some investigating on their own and they want to Google and deep dive? Where should they go?
Mental Health First Aid has a website that's dedicated to all types of questions about mental health first aid, along with the history of mental health first aid, along with a list of trainers, because sometimes people find trainings on Eventbrite and things such as that through different places. We find that going through mental health first aid training as a cohort, especially inside a hospital setting, is very advantageous because there's good sharing amongst the cohort. But if you really need or want that instruction, the Mental Health First Aid website is dedicated to getting those answers for you.
And that's mentalhealthfirstaid.org.
Thank you.
Thank you, Susan. And so Susan, Sonja, thank you both for being on with us today. I look forward to continuing the conversation. There's so much for us to dive into. Mental health first aid is a good first starting point of how you triage difficult, high emotions within a clinic. I think you all did this topic justice, and I really appreciate your time today.
Thank you.
Thank you for bringing it forward, Crystal. Yay.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.